Hello, I'm Norbert Gleicher, MD, Medical Director and Chief Scientist here at the Center for Human Reproduction in New York City. Our subject today is a subject we love here at the Center for Human Reproduction: pregnancy above age 40. Now, I'm not sure how many IVF clinics you will find who love to talk about age above 40. But we do because this is really our bread and butter. This is what the Center for Human Reproduction is really known for worldwide. And it is rare that a medical center can say something like it, but I can say it with complete openness and transparency. If you are above age 40, you will likely not get any better treatment anywhere else than here at the Center for Human Reproduction. Why? That is very easy to explain, because we have the experience. In contrast to most other fertility clinics, our experience in trying to help women to get pregnant with their own eggs does not end at age 42 or the latest at age 43, when most of our colleagues pretty automatically will send the patient into egg donation. We routinely, every single day of the week, yes, including weekends, treat women in the mid-40s up to the early 50s. I wish I could say we at that age have had already a healthy baby born with a woman's own eggs, but we have so far been successful only up to age 48. That's our oldest patient who had a baby with her own eggs, and she is, to the best of our knowledge, still the oldest patient in the medical literature who got pregnant with IVF. SCHR baby, in other words. So what does that mean, getting pregnant over age 40? If you really want to get pregnant with your own eggs, it means that you need a different kind of treatment approach than you obviously would need at age 35 or even at age 25. And this is really where most patients run into difficulties, because most clinics, as I already said, usually after age 42 and 43, the latest, send their patients automatically into egg donation. Some clinics actually mandate it. They will come out and say, if you want to continue working with your own eggs, we're not going to treat you. And therefore, no wonder they have no experience with this problem. I'm always at this point telling the story that I'm long enough in the IVF field to remember the very early days of IVF, when we couldn't get patients pregnant above the age of 38. And we didn't treat patients above age 38 for some time because we simply had no pregnancies. But then it became clear that unless we tried and learned, we would never treat women above age 30. And so everybody started trying, and everybody ended up learning how to treat women above age 38. But then once we learned that, we got stuck again at age roughly age 42 usually. And this time, nobody restarted trying, except maybe for us and maybe a handful clinic all over the world, but not many more. And so by us having continued to try, we have learned over the last 10, I would say, maybe even 12 years, how differently one has to treat a woman who is beyond age 42 and 43, where basically everybody starts. And that, of course, makes sense. Why would anybody expect that the treatment of a 45-year-old woman should not differ from the treatment of a 35 or a 25-year-old woman. Obviously, the ovaries of women age, and if we treat older women like we treat younger women, it simply doesn't make any sense. And that's where we differ from pretty much every infertility clinic in the US and probably worldwide. We treat you very, very different from our younger patients if you are above age 42, 43. And those differences are apparent at every stage of the process, from preparing your ovaries before we even start you in an IVF cycle, to how we stimulate you, to when we retrieve your eggs. Crucially important point. As women get older, the eggs have to come out earlier and earlier and earlier. And if you had told me 10, 12 years ago that we would do certain things which today have become routine, I would have declared you crazy. That's how different our approach is to the older patient. So if you want to find out more, you're always welcome to contact us. And I want to say it once again without exaggeration. If you are older, that doesn't mean old, just older in your ovaries, you will find no better care than here at the Center for Human Reproduction. Thanks for listening.